my name is Tamer Degheidy. I'm an internal medicine consultant, and I also work in the area of precision medicine. I teach and train. And for full disclosure, I sit on a number of boards and set up many, many companies. So this is important. I do not see patients here. I've got my clinic in another country, but I have my team that look after patients in this area. Thank you. So today, I was actually very happy to hear the panel speak about simplicity, the need for a system to actually be comprehensive and to make a difference to people's lives. I'm going to show you today how this actually can turn into a reality, because there's a lot of things going on. Longevity is now a buzzword, just like sustainability before that, and many, many other words. We want to really see things that really make an impact on people's lives. So let's start right away. The presentation overview is really for everybody to kind of get their heads around what we're trying to drive home with this. So the first part of it is really going to present the challenge. I guess everybody in this panel and everybody in the audience is aware of that because it touches everyone's lives. We also want to talk about the solution. What would be a better solution for that challenge that we're facing? Then we're going to introduce you to what I call the diamond system. Again, this is a system that was pioneered by our team, our research and development team that's been working with me, a multidisciplinary research team that is fantastic and fabulous. We'll talk about the hidden gem, the manifest gem, and the healing gem. There's one more that I've taken out for the sake of time. Then we're going to talk about a platform, show you some applications that touch your lives and everyone else's life in your circle of contacts. We'll talk about cell cycle, pathways, and environment, and quickly show you some publications so you understand whatever we're presenting is backed up by sound science. But more importantly, we'll show you case studies, because one of the panelists was talking about the importance of having actual patients changing, and that's very, very important. For us, everything is clinically driven and evidence-based. That's how we tackle this. I guess on the challenge, I'm not going to spend a lot of time because these are very, very common themes that I'm sure you've heard of over and over. Cancer and chronic disease is really on the rise, and everybody in this room, if I ask if you may just raise your hand if you have been impacted or a first-degree family member impacted with cancer, please raise your hand. Yeah, that's what I expect. So this started with everybody's getting that. And chronic disease, hypertension, diabetes, raise your hand, family. So we're all clients for this, for sure, and we need help. Financial burden is just growing. Current status quo is just unsustainable. We cannot sustain this, and I'll show you why. Actually, modernity living itself, the way we live today, is becoming a challenge to humanity, as it is. The way we sit, the way we type, the stress. Some panels spoke about mental health. This is very important. Current systems of care, they don't really do the job, if you will. There's a need for innovation in a new approach, if you like. And the challenge cannot be affected by one person. So everybody in this room, everybody in this conference, everybody who's involved, who's got a heart for this, is definitely needed to pitch in and help us develop a system to tackle this big, big challenge. Current state of affairs, we couldn't find the numbers post-COVID, but these are the numbers. They speak for themselves. You've got obesity going from 300 million in 2000. According to the WHO, it's 890. So that's 10 years, and the numbers doubled, right? You got stuff like, for example, cancer, which was new cases, 10 million new cases in 2000, jumped to 19 million, and positive now, it's north of 30 million. These are real numbers, and most of them, you'll see the references there, CDC or WHO and the likes, right? In terms of spending, it's even worse, actually.
if you look at cancer, $290 billion were spent in 2000, turned into 1.16 trillion. So that requires a deeper understanding of this problem. In 2000, we're not talking about 25 now. So think of where this curve is going. As I said, we couldn't get data beyond this that is worth showing. 200 billion on obesity, it's 2 trillion. It's double what is spent on cancer right now. So there is a requirement for solutions that can really address the problem at its root. Very, very important. What would be a solution proposed for this? So I'm going to take you into the basic philosophy. One of the panelists spoke about simplicity and how he likes to speak, how he likes to see things in a very simple way. It's very easy. First thing is we need to change the mindset on one point. This is currently the conventional approach, disease, health. It's a digital 1 or 0 approach. This is the status as you can see here, and this is how it looks today. Just shift your mind to think of this as a continuum, right? Once you think it's a continuum, you've got some place on this curve. You could be there, you could be here, you could be in the middle. And once you think of that, every little step that you take could really make a difference in your life, in the way you could improve along that continuum of health, continuum of wellness. So that's the main point. So how to get there? Let's look at the current modalities and let's look at our own definition of precision medicine. We've been in this field for so long, and I could tell you there's a lot of misconceptions around precision medicine. Mostly for physicians like myself, they think of precision medicine as in relationship to cancer, for example. This is not what we're looking at. This is the current model now. So you've got a conventional medicine model that looks at guidelines-based symptoms, drugs, and so on and so forth. We don't do away with this. In precision medicine, we use that. So I don't like the philosophy that says, dump this, let's all go green, because it does not work. Still, when you have an acute condition, we still need to use allopathic medications. That's very important, because when you go into integrative and functional medicine, you start seeing people using, let's avoid the allopathic medicine all the way. It's not good, it's bad for you. And there isn't a lot of specialization, which is very, very important in medicine. If you understand disease at its depth, then you can venture into the new ways of trying to tackle health problems. While if you're still junior and you don't really understand your subject and you just jump right into this, it does not really work very well, because you'll find yourself trying to move towards unproven methods, let's call it this way. Also, it's mostly generalized. So, those who have seen, anybody in the room who's gone to see, let's say, an integrative or a functional health practitioner, coach, or doctor? Oh, lots of them. Okay, so first thing, doc, gut. How's your gut going? We're going to do a colon sample. We'll look at your microbiome. It's off the charts. Here's some probiotics. Did it really change? So let's think about how much exercise and so on and so forth. Very, very, very unmeasurable approach in many, many ways, and lacks a lot of evidence, because I know of a lot of practitioners that do the testing before, that they don't do it after. So you really don't know if this is working or not. You may be feeling better, but you don't have data behind this. And that's what we're looking at, really. Data-driven clinical approach and an evidence-based approach. So when you look at precision medicine, our own definition of that is very clear. Uses best practices of functional, integrative, and conventional medicine. It integrates allopathic and what I call complementary medicine, because it's not alternative, it is medicine. We'll show you some publications. And it's a multi-omics diagnostics, avoids unnecessary testing, which is very, very important. You do tests that you don't need. If I can analyze your proteomic profile, but it doesn't help your case, it's a waste of your money and my time. Also, it focuses on preventative genomics. I gave a lecture before at a medical school, and on oncology, we had an initiative called Scan and Screen, where people can scan a QR code, give us a saliva sample. We'll look at some of the critically important genomics that are protective against cancer, so we can take actions today. And it was kind of being conflated with people doing mammograms, PSA testing. It is not the same in any shape or form. Also, it's got a measured progress, which means it's evidence-based and you can test things, and it's less practitioner-dependent. We want something that is less practitioner-dependent, which is a big dilemma and a complexity in the world of medicine. If you know your doctor, you're happy with them, you'll keep following the doctor wherever he or she goes. Also, it's personalized, very, very personalized. I heard the venture capitalist representative speak earlier about personalized. Well, we know this is a core part of our business and philosophy. Ideal solution would be using personalized medicine, which we just described, adopts a preventative philosophy, capitalizes on the innovations and advancements in omics, integrates allopathic complementary, automated, uniform, and AI supported with metadata. I'm not into, we use it, it's applied into what we do, but we know its limitations as well. So when people speak about AI working in the area of genomics, we know exactly what it can and it can't do. So I would be very careful about that for a while. This is what we call the diamond system of care. So it's very important, and it's a trademark of what we've developed over the time, how you approach health and wellness using that diamond and linking diamond to the word precision, which is very important. So the diamond looks like this. There is an upper pyramid and a lower pyramid, and in each part of those you can divide. We're looking at the hidden gem right now. So you look at the top part, when you look at the code and the genetics, this is how they kind of correspond to one another or correlate. Once you get into the epigenetics, you're looking at modulators. It's very important to understand that, because if you know how to work with these, you'll be able to understand the code in a better way. But you don't need to set up an entire institute for that. We need to use what can help the clinical picture today, quickly and the most cost-effective way. The next one is expression, and there we look at proteomics and how the proteins look like. That includes biomarkers and the likes. The environment, and we can see that through the markers. And we've got the signs and symptoms and the phenotypic expression. Actually, people come to you with the signs and symptoms right away. They walk into the clinic, they walk into the wellness center, and they ask you, I've got this problem, I've got a gut problem, I've got an issue with my skin, and so on and so forth. So they start at the bottom, but you need to be aware and well-trained in the rest of the steps of the pyramid. This is the hidden gem. The manifest gem, on the other hand, starts with diet and wellness. They're both correlated. You start with diet, the 13 steps for functional practice. Then you go into sleep, multi-system dysfunction. Then you go into stress, which is related to reduced resilience in general, digestion and absorption, which will lead to nutrition and nutrient deficiencies. Look at metabolism as well, energy dysfunction, and look at elimination with toxicity, and lastly, symptoms and illness and systems. So this is how it works. So wherever, it's very important to be trained to think like this, because wherever you will get a patient or a client that will click on one of these areas, you'll be able to relate this right away to the other side of, or the opposite side of the pyramid. Now there's two more pyramids. I've chosen one which is the healing one. There's one for the investigation. If you get trained in the system as a practitioner, it would be very easy for you to quickly move from step 1 to 2. And the system will help you, and we'll talk about that in a bit, in a sec. So the healing system starts with, well, let's look about wellness, let's do maintenance. So you're well, fantastic. Let's keep you that way. Let's keep you in that state. Let's make sure we're looking at prevention to maintain your wellness. But if you've got sleep issues, we need to work with sleep optimization, talking about neural and mental health. If you're talking about stress, we've got to do stress management. We'll show you what we do there, because we have actual things to be done for each and every one of those. If you've got digestion and absorption issues, we look at restoration, which is very important. Metabolism, supplementation or supplementation therapy. Toxicity, let's look at detoxification. And when you got organs that are dysfunctional, we really need to talk about allopathic medicine. You cannot come to someone who's EGFR 18 and say, we're going to put you on some simple naturopathic remedies. You have to work with naturopathy, you have to work with allopathy, you have to understand both sciences and combine them in your practice. And the minute you get into an illness state, That's when you use a multimodal approach, which will have complementary, conventional, working together to try to get you to the right point. So that's the healing gym. There's an investigational gym that I have actually skipped for the sake of time, actually. I'm trying to get through this, and we're just touching heads. This could be a 2-day workshop easily of training and education. Let's look at the platform. What would the platform be like? So we've had the panelists, they're not with us now, but they were talking about investing in AI, investing in systems, and that's very important. So let's look at how that looks like in reality. So what do you need? We need an algorithmic platform supported by a wellness and health-trained large language model. That's what you need at the core. So what are you going to train the AI on? That's very important. What are you going to train the language model on? So this is where our tech guys are working on trying to get it to learn from the huge data we have already in our data bank where we're working with clients. So it's very important to get that algorithmic system that is backed up by this LLM and allows you to integrate and start to automate a lot of these processes. What does it automate? Look at that. This is the input. So this is what you see in your clinic, in your practice. So you'll get stuff like this. You'll get diet, genomic data, stress analysis, sleep monitoring, unified examinations, very important, unified history as well, lifestyle, lab, physical activity, and vital monitoring. Each one of those, we've been working on it so that we could get stuff into the platform, and you'll see the outputs of that platform in a second. And then the output will take you into differential diagnosis, system dysfunctions, conditions, and then from there, you can do further investigations going back to the input box, or you go into conventional and complementary therapies as well. So that's how the system should be built from a system architecture, and that's how we're building it today, using exactly those pyramids that you have seen earlier in the diamond approach. Well, let's look at actually the examples, because examples, as I believe one of the panelists spoke about, the proof is in the pudding, right? So let's see if this works. So here's a unified history taking. You go to a good functional doctor, he catches you by asking the right question. He got you there. If you go to another doctor, he may miss it. You go to a good coach, they ask the right questions. Another one may not ask the right questions. How do you get this into a uniform format that saves time and money for everyone? So that's what we call uniform history taking. You answer that questionnaire if you're coming to the practice or to our ecosystem, because we've got multiple things in the ecosystems, including the lab and the clinic and the wellness center. You take that, and this is what the system is going to give you back today. So you're going to get an output that looks like this. So you're getting a score on your liver and gallbladder, small intestine, large intestine, mineral needs, essential fatty acids, sugar, handling in your system. So that would be very interesting. Not only that, you also get vitamins, you'll get adrenals, you get cardiovascular, kidney, and not only this, we talked about genomics, so you get the monoamine oxidase enzymes, A and B, slow, fast. How does it look like? So this is questionnaire, this is data that's available. You feed it into the system, it gives you that. So now we don't need to spend 2 hours in your first consultation. We know exactly where we're going with this. We just get confirmatory answers and we move forward. And it can be done with the well-trained health professionals or companions. We also want to check how the stress analysis looks like. So people speak about stress. Well, the DSM has got definitions for stress, and you could do a perceived stress test today where you just get a score. And the important is when you get the score on the PSS, that once you go through the healing journey, repeat it, you're doing better. This is how it looks into your portal today. It shows you that the PSS score is normal, 10. In this case, it's moderate. In this case, it's high. So you'll be able to repeat that test, and that is, again, somewhat fully automated, easily exchangeable with the client, we call them, because they're not always patients. What about cortisol? You need the lab to spit out your cortisol profile for the day. So we need to think about saliva. We always like saliva samples and saliva analysis, saliva testing. And this is how it looks like. So you get this morning cortisol, the car, 3 hours later, bedtime, dinner time, and bedtime. Very easy. And then the data has to analyze this. So we've had a lot of our clients that come in, and we were able to show this is where you were before, This is where you are today. So even if you don't feel good, this does not lie. For sure this is working. And we can show you that on your lab, which is very, very, very important and extremely useful for practitioners. Well, let's look at blood chemistry. Very big test. You take the test out all the time, so you want to know how it looks. Let's see what's going on here. Okay. So universal functional blood analysis. So you do the tests at our labs or any other lab. If the lab is connected into the system, they'll upload the data or they'll manually input the results, and they'll get an algorithm that is designed by clinicians to analyze the functions and the performance of different systems. It's going to look like this, something like that. You're going to look at nutrients, where you are in terms of score, proteins, nutrients, vitamins. We're going to look at organs as well, thyroid. We're looking at your adrenals and liver and gallbladder. And we're going to also look at different conditions. This patient particularly has got 61 on dysglycemia, so we could tell he's going there. Now you mix this with the other one, and the system, which is AI assisted, it's not the AI that diagnoses. It's not at that level there. Trust me, we know. We've been using it, training it. It's not as smart as you may think. So at this point, dysglycemia and the first functional universal history taking, looks like that we're dealing with someone who needs to lose a few pounds or improve their sugar metabolism, and the genomics also support that, so let's work with this. So this is another example. A third example is wellness monitoring. So we looked at all the wearables, and we looked at all the Garmin, the this, the that. Okay, fantastic. You've got a lot of data. Who's looking at it? You. So you wake up in the morning, you take a look at it. Does it relate to your chemistry? No. Does it relate to your genetics? No. So we had to design our own wearables, which we're showcasing in this Arab Health. And the wearables are integrated into the platform. So we're able to extract the right data that we want to see. You can still see it, feel happy about the exercise level, but we need to integrate it into your overall performance. So that's how we've looked at that, and this is how it looks. So we'll give you your sleep analysis. By the way, sleep on wearables on your hands, don't rely on this. They're not accurate, no matter what it is. We've checked them all. It's not the right way to measure the different stages of sleep. It can give you sleep hours. But we've done the comparisons, deep sleep, for example, REM sleep, and how it compares to EEG worn stuff. So all the data you'll see in the case studies have been done with EEG machines. So it's going to show you also, why are we getting there? It's going to also show you stress level. It's going to show you some heart rates, data. How do we apply this? Very important. So now we're going to science. I'm going to try to be very quick, whiz through it, because maybe not a lot of people here enjoy the science. Let's look at a healthy cycle, for example, healthy cell cycle. This is how a healthy cell, this is your normal cell cycle, right? So you go from growth, different, every G is a growth, every S is a synthesis, a 0 is when the cell decides to die, is getting ready to die. At each and every stage, you've got all these genes that make proteins that are responsible for protecting your cell against harm. Let's put it this way, simplified. So the very famous ones that people look at, they were discovered with breast cancer. They're called BRCA1 and 2, but in reality, they're not only breast cancer. They're involved in many, many other things. The BRCA1 and 2 and the RAT51 and 50 are all involved in the synthesis area. So as your cell starts to make proteins, those BRCA, call them auditors, they catch mistakes, they try to correct them, or they send them down to the TP53 pathway in the G1, where it eliminates the cell, sends it for destruction like the shredder. This system has to work very well. Now, if you've got mutations or variants in any of the genes and the proteins that are made in this area, please understand that when you get older, those proteins are not going to be as efficient. So don't think of it like I've got it, so I will get a cancer. Absolutely not. Genetics load the gun. They never pull the trigger, as I always say. And it's very important to think of it like this. And when you think of that, you will be able to understand that I've got a bit of a weaker BRCA protein, which means I don't need to kind of overwhelm it with tasks and work and so on and so forth. So that's how you look at a healthy cell cycle. Well, let's look at how that looks like in investigation, right? It's a nice science. Does it work? Do you have patients' data? Have you tested this? Absolutely. Investigating this. This is one of our cases. It's a signature design test that we put together looking at telomeric length and biological age versus chronological age, and we did it, yes, we did reverse age many times. We have many cases like that. 34 and 30, our proprietary algorithm for calculating the aging pace. So this looks like that. So now we're looking at how old your cells look like and feel like. The next thing is you look at a cytokine, what we call cytokine storm. So your asthmatic and your ESR CRP look normal, but when you look deep down in the cellular, subcellular level, you've got a whole cytokine storm. So you know there's a chronic inflammation. We need to analyze those and understand them and then address them. Another example is the mTOR checks, the world's only testing for the mTOR pathways, where we're looking at actual activation of the mTOR pathway. So in this case, the patient's got 16.5 activation, which means they're not really chronically inflamed. We also look at the Th1, Th2 balance. These are your T helper cells and where they are in different humoral or tissue-based immunity. This is how we look at our testing for oncology, and our genetics team look at that. Very easy, very simple test. We look at about 50 genes that are involved in that cell cycle, investigate it, and we found a lot of people that may have some mutations or variants, and we can quickly address them in terms of helping the patients recover. Healing the cell cycle, lots of modalities. So you've got a lot of people that set up, for example, clinics where they put red light, they put HBOT, but you've got to know what you're using. For example, you've got to use cell activation at 290 to 350 probably hertz. Anything below that is just, you might as well turn a light bulb in your room. Does not work. And you've got to use the right amps for the machine to drive this through the skin and the tissues of the client or the patient. You may want to include, that's complements. In supplementation, we were not able to get the right supplementation out in the market, so we had to formulate our own for AMPK, for example, methylation, and the likes of that. Now, for the sake of time, I'm going to try to skip through the healthy pathways and the healthy microenvironment and maybe probably show you a few of the actual cases that we have. So let me just jump through the pathways and take you right into the applications and the case studies, because we're a bit short and I promised 10 minutes. So I'm going to take you through publications. So you've seen basically the cell cycle. There's a similar one for pathways that is put 3-4 slides on pathways, and similar one that we've done on the microenvironment and the macroenvironment. So let's move to publications. Is this real? Absolutely, it's real. Well, here's a study that you can see that was done on 346,000 people, where we're able to say that you've got 146, 145, 142,000 of those having cancer. It's a big cohort study in France that are out of preventable. All these preventables, you see these green ones, they're preventables, and we can even work with the yellow ones, like occupation and infection, and the genetics is very important for us to understand it. So think of these 9, and think of how we can use this to actually impact patients. If you're a practitioner, if you're a clinician, this is how you should look at it. Very simple, again, to follow one of our panelists' words. Here's another study, very interesting. Now, these things are out there for years now. There's another study that talks about your daily protein intake affects your diurnal plasma levels of the neutral amino acids. Basically, protein intake can affect your mental health. It's very important. What are you taking? Are you taking tyrosines, making too much dopamine as well? Is your food rich in this? Is that why you're jittery? So if you don't fix that, you're not, and you don't understand the pathways, you're never going to be able to impact the difference. That's another one, genetic disorders as risk. So a lot of doctors now order NIPT for patients. So the pregnant lady, 8 weeks, wants to do NIPT, very interesting. What about the mother's risk having a mutation in her MTHFR or in her folate pathway, let's say, one of the genes? Well, this study says that you've got these few, can lead to risk up to 68% of Down syndrome. That's much, much higher than checking the aneurysms, the aneuploidies in the chromosomes. Very important as well. So we're, in this Arab Health, we've just launched the world's first mother and baby NIPT. So where our bioinformaticians were able to discern the maternal DNA from the fetal DNA and do the analysis on both, so we can give you a report that says, Mom, you can take iron, don't take selenium, and by the way, you have a higher risk for preeclampsia or gestational diabetes, and baby is free of any aneuploidies, so you don't have anything to worry about there. Here's NeuroDiet. I call it NeuroDiet. That's my own name. Diet can act as a drug, for sure. For sure. Again, another example of the neutral amino acids. This is actually my favorite. So in this particular study, people start the day, with a croissant. They start the day with a slice of toast. Very interesting. They eat it, and then they get a crash in the afternoon. This study talks about this. Very interesting. So you can tell right there that the patients actually, or the clients that start the day with carbs, and then they switch to proteins, they get a crash early afternoon. When you start the day with 75 grams of protein, 1 egg or 2 eggs, and then you can 2 hours later have some carbs, you don't crash in the afternoon. So this is timing, the rhythmic timing of how you can use nutrigenomics, and that doesn't require any analysis. The doctor needs to be trained in this, understands it, not just the doctor, the healthcare practitioner, and then they can help. This is our own published study. It came out in June, and it's a very high impact journal. The team and I have been working on researching molecular hydrogen inhalation therapy, and we just want someone to walk into the place and we know exactly what their reactive oxygen species levels are, and we want to impact them now, right there. So that's what we've done. We've done the study and we published, and it's in the journal Free Radicals if you want to look at it. The funny thing is that on average we got 15% right away with molecular hydrogen inhalation therapy. That's why you see a lot in Europe now where a lot of people are using this. You got to use the right rate though. If you have the lower rate, it doesn't work. 23% reduction within 24 hours. So the next day we measure, and people are even getting better. So we tested this with sick people, good people, people with asthma, people with cancer, and the results are very, very consistent. So that's what we use as one of our modalities, working on reactive oxygen species and looking at how that impacts health. Let's look at a few case studies, because I don't remember which one spoke about the proof. I think it's a gentleman at the end. Proof is in the pudding. So here's a 50-year-old female from the region, stress, fatigue, brain fog, and poor sleep quality. Very easy. You have it, see it every day. This is her results when she came in. Telomeric age is 61. Aging pace is 1.22. Gone through the journey, healing, and we worked with the different modalities. This is how she looks. 55, 107. We repeated these tests all the time. We've got results on real people and real data to prove this. Okay, so when we speak longevity, this is longevity. Let's talk about sleep. Remember, we addressed this in a pyramid. This is the same lady also. So we check the immune system, and this is how our sleep looks like. So in a night's sleep of about 6 hours, 7 hours, 8 minutes of deep sleep only. Well, forget it. She's never going to recover from any immune system problems. With the healing, this is how she looked at the end. Getting 2 hours of deep sleep at the end of the healing journey. So this is how it works, and this is real science. Now, if you'd like to take a look at another example, well, the healthy microenvironment. This is actually very interesting. Stress, female 43, fibromyalgia, which is a wastebasket diagnosis, by the way, and poor sleep quality. So this is how that looks. She walks in, she's 48 years old, biologically. Her ROS level is 515, which is right on the edge. Please be careful. If this lady had the other oncology test and she had a BRCA mutation and she keeps walking like that with that ROS level and that age of her cellular age level, she's almost guaranteed to get cancer by the age of 55 or so, especially after menopause. So we've taken her, put her on the programs, different methodologies, personalized to her. This is how she looks. ROS now is at 259. It's actually too low. I'd like to see it more into the yellow age. Age is exactly 44. These are real people, real data. Again, let's look at a healthy macro environment. That is very interesting because that was one of my cases. 39-year-old. She's just gone to all the gynecologists, looked at her. She has PCOS. She's trying to get pregnant again. She cannot get pregnant. She doesn't know what's going on. We start testing. I've asked the R&D team to develop something for the macro environment. I really want to look at phthalates and glyphosates and BPA. Very important for us. Especially, we've done her tests for her personalized genomics or polymorphisms, and she is a slow detoxifier, if you want to use the word, right? So her system doesn't clear toxins quickly. Her husband's just fine. He did no problem with him. So we check her system, and this is the surprise. Glyphosates, quite high, very, very high. And BPA, bisphenol A, is quite very high. So this is very, very interesting now. And she's gone to all the gynecologists. The classic conventional medicine, which I endorse, is not sufficient. You need to look beyond that. After going through a couple of therapy sessions, this is how her results look like. Fantastic. Menstrual cycle back, normal, everything's going well. We talk about mental health. This is good for mental health. So we've worked on some of our own proprietary supplements that are helpful for people with the anxiety level. We've tested it. This is going to come probably Q2 of this year, and this is how it looks. Please look at the wave frequencies of the brain in the middle section. Administration of what we call the supplements called Gold Mind, and 2 minutes later, from 5 minutes to 7 minutes, you see that, and look at where the effect is gone. So this is actually very, very interesting because everybody in this room will probably need this, including myself, starting with myself. 29-year-old female. All right, this is a familial hyperlipidemia, looking at polymorphisms in genetics. Our genetics team head is sitting here in the room today. We've done gene checks. So you go, someone with familial hyperlipidemia, he did his exome, genome, everything you want, and it just did not cut it. It's not giving him an answer because he doesn't have pathogenic, likely pathogenic, or variants of unknown significance in his. But we find for this person in the light density lipoprotein receptors gene, which makes the protein that actually regulates your lipids, we find a couple of polymorphisms that make up a truncated protein. So technically he's not sick, but the truncated proteins means it's kind of wobbly, it doesn't sit well with its target, and that leads, and everybody in his family, his father, 2 sisters, I think, they were all positive for this. Similar one for post-surgical bleeding. This is a patient from Germany. The patient has come. He's bleeding after the first eye surgery for ptosis, 2 surgeries. The doctor looks at his numbers. He's bleeding after the second surgery. She puts it off and says, I can't operate on you. You're bleeding until we find out. They send the sample to the lab. Everything is normal. Genetics, normal. So we run our own gene checks, and we look at this and look at that. We find polymorphisms in factor number 5 that actually behave that way only under stress. So only when you go through trauma, this becomes activated. Very, very interesting. We write to the doctor. I asked him, he's in Germany, so she didn't want to use any anesthesia, actually. So we sent this to the doctor, said, for God's sake, give him some anesthesia. He does it. No bleeding after his 3rd surgery. He's doing well and healthy. Thank you very much.